Hello, everyone. In this video, I'm going to talk about Mirabegron. Mirabegron is one of the medications that is used to treat overactive bladder. It is available as extended-release tablets, and it can relieve the symptoms of overactive bladder by reducing urinary incontinence, urgency, and frequency. It can be used both by men and women. It can also be combined with antimuscarinic agents like solifenacin for treating overactive bladder. This video explores key information about this medication, like how it works, what its effect is on urinary frequency, common side effects, and much more. First of all, let us see what happens in the overactive bladder. In this condition, your bladder contracts involuntarily, leading to a sudden and urgent need to urinate. Normally, the bladder contracts when it fills. However, in people with overactive bladder, the bladder contractions are out of control, and they may take place without any complete filling of the bladder, even when the bladder is not full. This loss of bladder control may be due to many of the reasons. In most people, damage to neurons may result in loss of bladder control. Neurons are mainly required for controlling the bladder contractions. But because damage to the spinal cord or trauma to the abdomen or pelvis may also cause the neuronal damage, this may result in a loss of bladder control, leading to increased frequency of urination. Sometimes these involuntary bladder contractions may also happen due to a few conditions within the bladder. Formation of bladder stones or tumors may also increase contractions of the bladder muscle, leading to an urge to urinate. A few conditions, like multiple sclerosis, can also produce the neuronal damage. You can also have an overactive bladder if you have an enlarged prostate. When the prostate size is increased, it can compress the bladder muscles, which increases the contractions, leading to overstimulation of the bladder. This may result in urinary incontinence. Sometimes you may have the symptoms of urinary overactive bladder because of any urinary tract infections. However, you can restore the symptoms once these infections are resolved. People with chronic diabetes may also have the risk of developing overactive bladder. Sometimes a few of the medications can also induce loss of bladder control. Particularly, medications that produce more urine or that make you drink more water may result in the symptoms of overactive bladder. Medications like calcium channel blockers, beta blockers, and diuretics may induce this condition when they are used for a longer time. High consumption of alcohol, cigarettes, and caffeine can also irritate the bladder, leading to incontinence. How to take this medication? Mirabegron is available as an extended-release tablet at two strengths, 25 milligrams and 50 milligrams. This medication can be taken with or without food. This tablet can be swallowed whole with a plain glass of water. You should not crush, chew, or break this tablet, as it is specially coated. For treatment of overactive bladder, it is indicated at a dose of 25 milligrams given once daily. The dose may be increased to 50 milligrams based on the response. In people with renal or hepatic impairment, the dose may be reduced to 25 milligrams only. Mirabegron can reach its peak plasma levels after 3 hours. However, a steady state can be reached after 7 days of the treatment. It may take a few days to see improvement in the symptoms. You may see its effect at least after 2 weeks of treatment. However, in a few people, the time to see full beneficial effects may be extended up to 12 weeks. Mirabegron can also be combined with solifenacin to control symptoms of overactive bladder. In such conditions, Mirabegron is used at 25 milligrams combined with solifenacin at 5 milligrams. This combination is given once daily. Based on the clinical response after at least 4 weeks, the dose of Mirabegron may be increased to 50 milligrams. Now let's see the precautions for this medication. This medication may increase your blood pressure. If you have pre-existing hypertension, this may be more troublesome. Therefore, regularly monitor your blood pressure while taking this medication. This effect is also more observed in children below 12 years. Since Mirabegron inhibits bladder contractions, it can produce a quite opposite effect due to relaxation of the bladder muscles. It can produce urinary retention. This urinary tension may be more enhanced in the people with any bladder outlet obstruction. If you are using any muscarinic antagonist, again, this effect may be increased. You cannot empty your bladder fully, and you may have difficulty starting urination. You may have a weak stream of urine every time you try to pee. You can also have a feeling of non-emptying of the bladder even after urination. It may also produce lower abdominal pain and bloating. You may have leaky urine. Therefore, if you observe any severe difficulty urinating and a weak stream of urine, you may discontinue this medication. Mirabegron can also produce swelling of your face. This may happen within a few hours after the first dose of this medication, or else it may also be observed even after multiple doses. This condition is called angioedema. It is one of the hypersensitive reactions that may be observed with many of the medications. It may also cause the swelling of the tongue and larynx. If so, it may result in life-threatening respiratory problems and difficulty breathing. Therefore, in such conditions, you have to discontinue this medication. If you have any known hypersensitivity with the use of many medications, the use of Mirabegron may not be suitable for you. Mirabegron can affect the metabolism of other medications you are taking. It acts as a moderate CYP2D6 inhibitor. Therefore, those medications that are mainly metabolized by CYP2D6 in the liver are affected. Medications like metoclopramide, amitriptyline, and metoprolol may be used cautiously with Mirabegron. Since Mirabegron is going to reduce the urinary flow, it may affect a few of the medications that are mainly eliminated in the urine. Mirabegron increases the plasma concentrations of digoxin. Digoxin is an inotropic agent, and it is used to treat congestive heart failure. It has a narrow therapeutic window. That means any small change in its levels in the body may produce significant toxic effects. Digoxin is primarily excreted in the urine as unchanged. Even the exact mechanism is not clear. Mirabegron can increase the levels of digoxin in the body by affecting its excretion in the urine. This may result in a few symptoms like rapid heartbeats, difficulty breathing, vomiting, abdominal pain, confusion, and visual problems. Therefore, before you use Mirabegron, the levels of digoxin in the body should be assessed. The dose of digoxin should be properly adjusted in case of its raised levels. What are the side effects? One of the important side effects of Mirabegron is an increase in blood pressure. It can also produce urinary tract infections. A few other side effects, like headache, stuffy nose, and sore throat, can also be observed. You may also have bronchitis and upper respiratory tract infections. Dry mouth, constipation, and urinary retention can also be observed. A few people may have a sudden feeling of heat, redness, and sweating. It can also produce itching and skin rashes. How does it work? Mirabegron controls how your bladder is going to contract. Normally, the bladder contractions can be controlled by the sympathetic system. Neurons supplying the sympathetic discharge can act through the beta-3 adrenergic receptors that are located on the bladder muscle. Activation of these receptors may lead to bladder relaxation that results in the increased bladder capacity. This increases filling of the bladder. In people with overactive bladder, bladder contractions are increased, and they are out of control. In such people, Mirabegron can be used to control the symptoms. It selectively acts as an agonist on the beta-3 adrenergic receptors. This results in the increased relaxation of the detrusor smooth muscle and an increase in the bladder filling capacity. This relieves the symptoms of overactive bladder. You may notice a decrease in the frequency and urgency to urinate. That's all, guys. These are the key facts that you should know before taking Mirabegron. Thanks for watching this video. Share your experience and how it works for you in the comment section below. Have a great day.